Hey guys, welcome and thanks for taking a few minutes to go through this with me. My name is Adam Reynolds with SRS Insurance Group. This is a simple educational walkthrough designed to help you understand Medicare so you can make the right decision without confusion or second guessing later. Now, even though I've tried to simplify this as much as possible as one can on a short video like this, it's still a lot to cover and we're not covering everything. So feel free to go back and watch this as many times as you need to, or you can save yourself a lot of time and heartache and just simply reach out to me. Think of me as your Medicare Easy button. But if you don't already have one, I'd press pause, go grab a pen and a piece of paper, and take notes because we are going to go over quite a bit. But again, there's no way to fit all of it on one video. And it may just be simpler for us to have a conversation. So with that, we'll go ahead and jump into the first slide. This is our contact information, website, email, and phone number. As we go through this, just keep in mind any questions you have, we're going to make sure to get those answered either on this video or by the end. I'll show you how to schedule some time with me so that I can get those questions for you on a phone call. Our goal is pretty straightforward. We're going to help you get your questions answered. We're going to help you gain a better understanding of this than when you started. We're going to show you your options because you do have good choices in all of this, and hopefully give you a sense of who we are so that if you want help, you feel comfortable reaching out. You feel like we're already in your corner because we are. At this point, most people have already started receiving tons of mail and probably tons of phone calls. Raise your hand if you're one of the millions who are getting 10, 15, 20 calls a day from God knows who, trying to get you to let them enroll you in some plan that you have never heard of, and never even taken into account who your doctors are, who your hospitals are, who your medications are, who you are as a person, what your needs and wants are. It can feel like a whole lot is coming at you very quickly, and that's because it is. It's normal to feel that way. This system doesn't seem to be designed to be simple. So that's what we're going to do today is break it down, try to bring you some clarity with all of this so that, to kind of lower the overwhelm that's going on right now. And don't feel bad if you are overwhelmed. That's typical. That's normal for people coming into Medicare on the front end. Now, eligibility is pretty straightforward. Most people qualify based on their work history, about 10 years worth. The most common situation is turning 65, but there are other scenarios like disability or coming off of employer group coverage. The key point is there are different ways that people enter into Medicare and different ages they can enter into Medicare, but all of them do have one thing in common, and that is you qualify for Medicare Part A, at least for no premium on Part A, as long as you've worked full time for about 10 years and paid your Social Security or Medicare taxes. Now, you see from this slide right here, you put this at the top, why does Medicare keep calling me? Let me clarify that. Medicare doesn't keep calling you. These people that are calling you are not actually Medicare. They're private companies with marketing plans that have hired call centers to come out and just blast calls out into the ether, trying to get as many people to bite as they can. And all you're looking for is information on Medicare or information on Social Security. And you can go to these sites or these numbers, 1-800-MEDICARE or 1-800-772-1213 to go directly to the source. Now, I will warn you, the hold times on these numbers can be absurd sometimes, hours. I stayed on hold with a client one time who needed help from Social Security, and I helped them dial in and actually stayed on hold with them for 2 hours. Unless you just have time to kill, I wouldn't recommend doing it. You can get most of the information online, or if you get lost online, you can always just reach out to me. Now, enrolling in Medicare, enrollment depends on whether or not you're already on Social Security. Now, what I mean by that, if you are already drawing a check from Social Security, then Social Security will enroll you automatically in Medicare Part A and Part B. Now, if you're not ready to hop on to Part B, and there's reasons why you might not be able to, if you're drawing Social Security, but you don't want to start Part B, you do have to proactively let them know so that they don't start Part B during your birth month of your 65th birthday. If you're not already on Social Security, you'll need to sign up for yourself, which is a pretty simple online process. It's harder to actually get logged in than it is actually to fill out the application, but I can help you with every bit of that. I walk people through that process almost every day. And it's hard if you don't know where you're going or what you're doing. It takes you a lot of time to do it, but not saying you can't do it. It's just going to take you a lot of extra time. And I can help you go through it very quickly. Now, as far as your enrollment window is for Medicare, your initial enrollment period is 7 months. The way that breaks down is 3 months before your birth month, then your birth month, and then 3 months after your birth month. So for me, my birth month is September. So I could enroll in Medicare as long, we'll count back September, and then August, July, June. I can enroll as early as June to be effective September 1st. I can enroll in June, July, or August, or enroll in September, or I could do it 3 months after my birth month, which will be October, November, December. So the latest I can enroll in my initial enrollment window would be, for me, would be December of that year, and still avoid any late enrollment penalties. Now your start date when does your Medicare begin? Your start date depends on your birthday. All right, most people begin coverage on the first of their birth month. The only exception to that is if you were born on the first, then your coverage would start the month before for Medicare Part A and Part B. So going back to my birth month, again, September, my birthday is September 22nd. So my effective date or my start date would be September 1st. But had I been born on September 1st, my effective date or my start date would be on August the 1st, the previous month. So it's just something to keep in mind. Most people aren't born on the 1st, but if you are, then you actually get to hop into Medicare a month early. Now, here's where we're going to break down what original Medicare is. You have Part A, and when you hear Part A, I want you to think hospital. And when I say hospital, I mean the physical stay at the hospital. I mean the room and the bed that sits in the room. That's covered by Part A. Now, Part A is usually premium free if you've worked long enough, which we've already covered that. If you work 10 years full time, or in Social Security language, that means you've worked full time and you've paid your Medicare taxes for 40 quarters. 40 quarters would equate to 10 years. So just keep that in mind. As long as you've worked long in your life, worked a combination of 10 years, then your Part A costs you nothing. You've already paid the taxes on it. But even though it's free, Part A is not unlimited, okay? So here's how Part A works. There are deductibles. Part A and Part B. Part A has deductibles and daily costs depending on how long you're in the hospital. And this is where most people start realizing there are gaps. But we're going to cover how to overcome those gaps moving forward. So here's some of the big gaps for Medicare Part A. Original Medicare is a fee-for-service health plan. It's broken into Part A and Part B, but we're going to talk about Part A right now. Part A is inpatient hospital stays, skilled nursing facility, hospice, or home health. And here's how it works. That number you see on your screen is for 2026, $1,736 deductible. That is not an annual deductible. I repeat, that is not an annual deductible. That is a per incident deductible. So you could go into the hospital in January for hip surgery, and you're in there 3 or 4 days, maybe longer. You would have a $1,736 deductible for the hospital stay for those days you were in the hospital. Now let's say you had to go back in March or April, and you had something said, you had a fall, and you had whatever, or you'd been in a car wreck and you were in the hospital for a few days with a neck injury or a back injury or whatever, you would have another $1,736 deductible. Then you go back in August and you've got some other thing that caused you to be admitted to the hospital. You yet again have a $1,736 deductible. It's per incident, not annual. Now, after you've paid your deductible, days 1 through 60 for your hospital stay is $0 after you pay that deductible of $1,736. Days 61 through 90, though, jump up to $434 per day in a copayment. And again, this is just for the hospital. This is where Part B comes in and pairs with Part A. Part B, think medical coverage, okay? But it does have a monthly premium. So 2026, the standard premium is $202.90 per month for Part B. All right, so Part B is $202.90 per month as part of the standard premium. Now, what does that mean? That means, and then we'll get to the deductible, but that means if whether you're drawing Social Security or not, per month, $202.90 is going to come out of your account. It'll either be taken directly out of Social Security, or you'll be paying for it out of your checking account for Part B. Like, that stinks. What is Part B? Part B is medical coverage. Okay, it's, as I said, original Medicare is a fee-for-service health plan. That means you pay a fee for what service you receive. Part B is the medical part of original Medicare. Medical would be any doctors, equipment they hook you up to, images they take, medicine they put in your body, any type of medical service they give you in the hospital, anesthesiologist. That's all covered by under Part B, as in Bravo. Doctor's visits outside of the hospital, emergency room, urgent care, any type of physical or occupational therapy. That's all Part B medical insurance. And here's how Part B works. Part B only has a $283 annual deductible in 2026. So it's not like Part A. It's not per incident. It is an annual deductible of $283. After you have met that deductible of $283, then your copayment or your coinsurance is 20%. So Medicare Part B would pay 80%, you would pay 20%. And you're like, if you're talking $100, that ain't bad. The bill's $100, Medicare Part B pays 80, you pay 20, not bad. But then you get to $10,000, $100,000 hospital bill, $500,000, $1 million in Medicare medical costs. That becomes very significant and can actually break you. Because the important thing to know about that is Medicare Part B has no cap. So if you're on Social Security, your Part B premium will be withheld from your Social Security check automatically. Okay, but if you're not on Social Security, you'll receive a quarterly premium notice from Medicare to mail in your Part B premium. And a quarterly Medicare premium right now is somewhere around $611. Sometimes you'll get an $800 and something bill because they want 4 months at one time, depending on when your birth month is. But I can show you how to set that up so where you don't have to pay that in such big chunks. You can set it up to pay the $202.90 per month, and it's a much easier solution than trying to remember to hold on to $600, $800 every 3 months. Will I receive a penalty if I stay on my group coverage? If you're no longer employed and decide not to activate Part B, you will receive a Part B premium penalty. Okay? The Part B premium penalty is a permanent penalty and is 10% of each 12-month period that you were eligible for Part B but did not take it. So that's what you have to consider is you can continue to work and go on Medicare, or you can retire and go on Medicare, or you can continue to work and stay on your employer coverage. But if you decide to, let's say you retire and they say, hey, you can stay on our group coverage after you retire, then you would have to enroll in Medicare Part B because you would not be actively employed, but you would still be getting the coverage. So that would not exempt you. You need to be actively working and have creditable coverage for you to avoid a late enrollment penalty if you decide not to enroll in Part B out of the gate. Okay, so you need to watch out for that because that late enrollment penalty is a lifetime penalty. Things to consider: group versus Medicare. If you're still working, you're going to want to compare your group coverage carefully. Sometimes staying on it makes sense. Most times Medicare is the better move. Things to consider is what's my monthly premium, not what am I paying every 2 weeks, because every 2 weeks times 2 is not your monthly. Every 2 weeks times 26 is, and then divided by 12 is your actual monthly premium. You want to know what your deductible is. Is it $1,000? Is it $5,000? Is it $10,000? What's my coinsurance? Is it 20% for this, 40% for something else? What is it in the hospital? Is it a flat $2,500 fee for hospital admission, or do I have a coinsurance or a copay? What's my maximum out of pocket? What limits my exposure on my group plan? What are my copayments? How are my prescription drugs covered? I may be taking some pretty significant medications and the group coverage is covering them, but it's not doing a great job. And if I switched over to Medicare, I could save hundreds, if not thousands. Those are all things we need to consider before we make a hard decision on whether to stay on employer coverage or move on into Medicare coverage. One other consideration is if you're married. If your spouse is not on Medicare yet, say you're turning 65, but your spouse is 62, there are still options for your spouse. So if you're 65 and you have coverage through your employer that has you and your wife, or you and your husband, however that arrangement is, has both of you covered, and then you were to drop your employer coverage and go on to Medicare, you're not leaving your spouse out in the cold. Your spouse does have options to either go through marketplace coverage through healthcare.gov, and your premiums are based on your income. They would look at that and determine if you could qualify for any tax subsidies, and I can help you with that. There are also health share programs like MediShare or OneShare, or there are numerous others which are a kind of a health cost sharing program that might be a cheaper option. And then there's short-term medical. So say maybe you aren't 3 years apart, maybe you're only three months apart in age, and you go on Medicare, but she or he is going to be left without coverage for 3 or 4 or 6 months. Well, may not make sense to enroll in a full-blown insurance plan as much as it would be to just get a short-term medical to cover you for that small gap. So these are all things that we've discussed when we look at planning your move onto and into Medicare. Now, has your Medicare been checked yet, this AEP or OEP? And why does Medicare have so many initials and abbreviations? So there are specific enrollment windows each year, and missing them can limit your options. So it's important to stay aware of timing. So for AEP, also known as the annual enrollment period, that runs from October 15th to December 7th. The OEP, open enrollment period, it runs from January 1st to March 31st. We'll kind of get into some details about that later, but I can tell you the AEP, when you enroll during that starts, or those plans that you enroll in during that window, go into effect on January 1st of the following year. Now with Medicare, you do have coverage choices. You have, as we've discussed, Part A and Part B for original Medicare. But then you can, and remember the gaps that we talked about, which are significant, and some of them are huge. You have the option to go either with a Medicare Supplement plan or go with a Medicare Advantage plan. Medicare Supplement plan works with Part A and Part B, and any gaps that were not paid for by Part A and Part B, your Medicare Supplement will take care of that. It'll cover those copays. Okay? If you hear somebody say Medigap or Medicare Supplement also, they're talking about the same thing. Those are both the same type of policy. Now, with a Medicare Supplement or a Medigap policy, you do not have drug coverage, you do not have dental, vision, or hearing coverage built in, because Medicare does not cover those. So you have to get separate standalone plans to add on with your supplemental plan. Okay, your other option is a Medicare Advantage plan, which is also known as Part C. That combines Part A and Part B and then bundles in things like your dental, your vision, your hearing, your drug plan, and a lot of times even bundles in like a gym membership or other benefits to really make it appealing for you and worthwhile for you to go into a Medicare Advantage plan. but we'll cover that in more detail. All right, so choosing your hospitals and doctors, this becomes critical. With a Medicare supplement, you can go to any hospital, any doctor, anywhere in the U.S. as long as they accept Medicare, and you don't need referrals. Okay, so you can go anywhere in the U.S. is quote unquote in network, because there is no network as long as they accept Medicare Part A and Part B. Prescription drug coverage is one of the biggest cost areas you'll find in Medicare. Okay, and those plans change every year, which is why reviewing them annually is vital. Otherwise, you could end up paying significantly more than necessary. So it's the number one expense for Medicare beneficiaries. Enrollment during your initial enrollment period would be 3 months before your birth month, and then three months before your Part B effective date. Okay. Annual election period is October 15th through December 7th, which means you can change plans during that time of year to become effective January 1st of the next year. And if you don't, you can end up spending hundreds, if not thousands of dollars more than you should during your upcoming year if you don't get this right during this time period. You have the annual election period, as I said, October 15th through December 7th. You have tiers of drugs that change annually, even within the same company. Even within the same plan, the tier structure can change. So what was once a tier 1 or tier 2 drug might bump up to a tier 3 or tier 4 drug. Suddenly you got a larger copay, and now deductibles are come into play with those drugs because they're no longer tier 1 or tier 2. Also, pharmacies drift in and out of network, drift in and out of being preferred. So you have preferred, standard, and out of network. And if you hit a pharmacy, if you start trying to get your medications from a pharmacy that's standard or, God forbid, out of network, then you're going to pay a lot for your medications when you shouldn't be paying anything. So the cost of late enrollment penalty, a Part D, not a Part B, but a Part D enrollment penalty, it depends on how long you went without Part D or creditable prescription drug coverage. Okay, remember, plans change every year. Medicare calculates what your penalty will be by multiplying 1% of the national base beneficiary premium. In 2024, that was $34.70 times the number of full uncovered months you didn't have Part D or creditable coverage. Now that national base beneficiary premium does tend to increase each year, so your penalty will likely increase each year as well. So you just don't want to even get involved with that. And again, there are multiple paths. What works for one person may not be right for another. I'll say that again. What works for one person, what works for Uncle Bob or Aunt Mary may not be what's right for you based on geography, based on your network of doctors, based on the prescription medications you're taking, as opposed to what they're taking. So you really need to look under the hood and see what each plan is. Now, Medicare Advantage plans are run by private companies, as I said, who can join a Medicare Advantage plan. You must have Medicare Parts A and Part B and live in the plan service area to be able to join. How much does Medicare plan cost? Usually nothing. Usually, as far as a premium is concerned, now you do have copays and coinsurances, but as far as a monthly premium, Medicare Advantage plans usually are very low premium or zero premium. You would just be paying your Medicare Part B premium. But again, each one is different. Each case is an individual case. So you really want to go over with someone who knows what they're doing, who can put you in the most appropriate plan for you, not on what was the most appropriate plan for that friend or that family member. Now, there is a special subset of plans within Medicare Advantage plans called D-SNPs and C-SNPs. Say that with me. D-SNP, C-SNP. A D-SNP is dual eligible special needs plans. These are built for people who qualified based on their income for Medicaid, which is a state program. Medicaid, if they're qualified for any level of that, then they will be qualified for some sort of dual special needs plan. Okay, and these plans, when you're qualified for Medicaid, one of the biggest things that it does is it covers your Medicare Part B premium. But then for other special needs plans, what did I say? I said D-SNPs and then what? C-SNPs. A C-SNP is a chronic special needs plan, which means you have some kind of chronic condition like congestive heart failure or diabetes, something like that. Then that qualifies you for what's called a C-SNP, which is a chronic special needs plan. If you got kidney, heart, liver, something funky going on that's a chronic condition with your health, you very likely are going to qualify for one of these plans. So these are all things that we would take into consideration. Okay. Now, Medicare Supplement versus Medicare Advantage. Here's a side-by-side comparison chart. So starting with the Medicare Supplement Plan G, which is only one of the types of Medicare Supplement plans, but is the most common these days. Plan G plus prescription drug plan, you're going to pay higher premiums, but you're not going to have any copays. You're going to have the $283 Part B deductible that you will need to meet. But you will have the freedom to choose what doctors or hospitals you want to go to. You won't be dealing with the referrals. You typically routine services like dental, vision, hearing, drug coverage, those are not covered by a Medicare Supplement or a Medigap plan. And you will be covered anywhere in the U.S. from Hawaii to the southern tip of Florida. You will be covered as long as that physician or that hospital takes Medicare. They would have to take your Plan G. Now, over on the other side, you have Medicare Advantage with prescription drug coverage, or MAPD. That's generally lower premiums, a lot of times no premium, but it has copays and coinsurance leading up to your MOOP, or your maximum out of pocket. You do have networks that you have to deal with. Now, these networks are large. Don't think it's like 3 or 4 doctors in some kind of creepy little clinic somewhere. These are robust networks, and you have HMOs and PPOs with Medicare Advantage, so you can go out of network if you need to, but like a regular PPO, you would pay a little more if you went out of network. But you may need referrals for specialists, especially if it's an HMO plan. But these plans will include extra benefits like dental, vision, hearing, fitness, and over-the-counter benefits. Also, drug plans will be included in a MAPD, Medicare Advantage prescription drug plan. If you go outside of the service area, though, emergency services only are what's covered. Not if you're feeling bad and you ran to the ER as opposed to the urgent care, but if you actually have an emergency that requires you to go to the ER, that would be covered outside of your service area. So why choose SRS Insurance Group? That is an excellent question, and I hope to answer that. This is where the real decision happens. Am I going to pay a higher premium versus a lower premium? Do I value flexibility or networks, or do networks not bother me that much? Do I value predictability, or do I value pay as you go? And I can tell you there's no one-size-fits-all answer. I have married couples who one's in a supplement and one's in an Advantage plan. It just depends on what makes the most sense for your particular situation. SRS, we treat every case as an individual case. There are no cookie cutter solutions with us. We offer all available Medicare plans and a large majority of the Medicare carriers in the industry. We shop your Medicare and prescription plans each year to ensure that you're paying the lowest price available for the upcoming year. We are accessible. You don't know what you don't know. You don't know what it's like to sign up with a Medicare agent and then never hear from them again. And anytime you have an issue, you pick up the phone and you can never get them on the phone. Why? Because they're transactional, they're not relational. They're after the sale, they don't care about you after that. We are relational. We're in this for the long haul. We're in here to form partnerships with you in regards to your Medicare and your retirement. What does that mean? We're accessible. If you call us and you get my voicemail, that's simply because I'm either closed that day, on vacation with my family, or I'm on the phone with another client. If you need something urgent from me, I will always encourage you to text me and reach out that way to let me know, hey, Adam, I have an urgent question. Can you please get back to me ASAP? Then I'll find a spot to work you into my calendar and get a call back to you, typically within 24 hours. All right? So we are accessible where other agents typically aren't. Now, our services come at no cost to you. We are paid by the insurance companies to take care of you. Now, just because I'm paid by the insurance company does not mean I worked for them. I worked for you, not the insurance company, which means I hold zero bias to any insurance company. I'm completely independent. I'll say that again. I'm not married to any of these carriers. So I will be looking at your particular situation and matching you up with the most appropriate for you, not for the carrier. Okay? So I do work for you. To always keep that in mind. What we do is help you compare all of this objectively. Again, we're independent. We shop plans every year for you, and we focus on what's best for you, not a specific company. If you want help reviewing your situation, you can scan the QR code that you see on the page, book a quick 15-minute call, no cost, no obligation, just clarity. Or you can always call, text, or email directly. We are here to help you whenever you're ready. At Srsig, our focus is production you can count on, guidance you can trust. I hope this has been helpful today, and I hope you've been blessed by it. If you have any questions whatsoever, use this contact information or use the QR code that was on the previous screen. You can rewind it to go get that. But you can use the QR code or this contact information to reach out to me and schedule an appointment, and then we'll get any remaining questions that you have answered for you. All right, you guys have a fantastic rest of your day, and I look forward to hearing from you and working with you in the future. God bless.